What should I expect after arthroscopic surgery for torn meniscus? Basically, a torn meniscus can be removed or can be repaired by arthroscopic surgery. We will consider first scenario where arthroscopic removal of torn meniscus is done. In this surgery, the recovery is very fast. After the surgery, his patient is in a brace and patient walks full weight bearing right from day one of the surgery. Because the torn part has been removed, there is no chance of the repair getting hampered. So patient can be mobilized immediately, range of motion can be started and physiotherapy can be started within 2 to 3 days of the surgery. So surgery, arthroscopic surgery for torn meniscus where meniscus is removed, the recovery is very fast. The second surgery is arthroscopic repair of the torn meniscus. In this surgery, arthroscope, that is camera, is introduced in the knee joint. The torn meniscus is repositioned and it is repaired using an internal repair technique. In this surgery, because meniscus has been repaired, patient will be in a belt or a brace for a period of at least 6 to 8 weeks. Patient will be kept either non-weight bearing or partial weight bearing depending upon how big and how was the repair of the meniscus. After the surgery, after 2 weeks or 3 weeks, patient will need graded physiotherapy where range of motion will be increased from 0 to 90 degrees over a period of 1 month. So the recovery after repair of meniscus, which is done arthroscopically, is longer, the physiotherapy is longer and patient has to be very cautious and careful during the recovery.